All right, and I think I'll move that. Can I move that box? Here we go. All right. So the call is being recorded so that we can post this on our SHIP SMP volunteer YouTube link, and I will be sending that to you later. And you should have received the PowerPoint presentation as well as the cost tip sheet so that you can refer to those documents. And the PowerPoint is screenshots of that cost tip sheet so that we can break it down into really readable parts. And so we'll be going through that. I'm also referencing some pages in the 2019 volunteer manual. So I will share those page numbers that I am on with the slide in case you want to make a note so that you can go back into your volunteer manual and actually read more detailed information about the topic that we are discussing. And I'm going to pause for just a moment and add some folks to the list so that you can get credit for attendance. Give me just a second for that. And if you could, type your name in the chat box, and that way Lonnie can jot those down for me, and we can make sure that we are not missing anyone. So let's go ahead and get started. And let's talk about the cost tip sheet. And on that cost tip sheet, we go into great detail about Part A, Part B as in boy, D for drugs, as well as subsidy details. So we're going to be talking about that today. So let's look at Part A specifically. And remember, Part A is hospital coverage for the Medicare beneficiary, and we're going to look at that premium. And in the 2019 volunteer manual, I'm talking about information on page 23. So most people that enroll in Part A are able to have that premium at zero cost. And because they have paid into their FICA tax and they are getting this premium free, but they do have to have worked at least 40 or more quarters to get it at zero. On page 25 of the manual, we go into a little bit more detail about benefits, but before we get to the benefits, I want us to look at the premiums for those people who did not work the 40 quarters. And the 40 quarters equal about 10 years. So most folks now work at least 10 years in their lifetime. But if they don't, then they've worked less than the 40 quarters, between 30 and 39, then their Part A monthly premium would be $252. If they worked less than 30 quarters, then their monthly premium is $485. So you can see that it can be quite expensive if someone has not worked those quarters. Any questions about the Part A premium? I don't want to move too fast and I don't want to move too slow for you guys. Melinda, your hand is up. Do you have a question or is that just?
Just a mistake, sorry.
Okay, no problem. No problem. All right. So we've talked about the premium. So on that cost tip sheet, we also have Part A deductible and co-insurance amounts. And this is where, when we're talking about original Medicare, versus Medicare Advantage that we definitely want to be clear on as counselors so that they can really have the information they need, especially for their initial enrollment, to choose which option of their Medicare benefit that they want. Once they already are enrolled, whether it's an MA plan, we'll talk about that a little bit, but with Original Medicare, these are going to be your deductibles and coinsurance. So anytime someone is admitted into the hospital, their Part A deductible for 2020 is $1,408. If they stay longer, so they have the deductible. If they stay longer than 60 days, on day 61 through 90 days, they will have a daily copay, coinsurance, of $352. So you can see in years past when people were able to stay in the hospital for months for minor surgery, that no longer occurs. So we don't see this that often, but when someone is very ill, this is a possibility. They also have a higher daily coinsurance or copay if they stay in the hospital past 90 days, and on the 91st day, then their daily copay would be $704. And I wanted us to kind of remind ourselves of benefit periods. So the benefit period refers to the way that Medicare measures the beneficiary's use of hospital and skilled facility services. And so right now we're just showing the hospital. And so let's look at the skilled. So if someone goes into the hospital and we know that they have fulfilled their hospital stay to receive skilled nursing care, if that has occurred, then they can use their Medicare benefit for skilled services. If you're in Original Medicare, the first 20 days of skilled nursing is at $0 coinsurance. On day 21, that coinsurance or copay is $176 per day, and that's through day 100. After the 100th day, Medicare no longer pays for that skilled service, and that Medicare beneficiary becomes 100% private pay for all those services. Now, with the Advantage plans, these benefit periods may vary, and the coinsurance may vary, and that is for the hospital coinsurances and deductibles as well as the skilled. So I wanted to go back to the benefit period. So the benefit periods for both the hospital stay and the skilled begins on the first day of admission, in-house care, and it's not observation if they're in the hospital. We got to keep that in mind when we're talking with folks. The benefit period ends when they are no longer in the hospital or receiving skilled nursing care in that skilled nursing facility for 60 days in a row. So if they go into the hospital after one benefit period has ended, then they will have a new benefit begin. So they could possibly have to pay that $1,408. And I think one year we did the math, and if someone went into the hospital after each of their benefit periods ended, they could possibly pay that Part A deductible 6 times. So you can see that that can be quite expensive for our frequent flyers in hospitals. So that is for the Part A premium and coinsurance. Are there any questions on those two blocks? So let's move on to Part B, and I know most of you are well aware that Part B covers medical services, which is your doctor visits, your lab work, and outpatient services, those types of things. So Part B does have a premium, and on the cost tip sheet you can see that most Medicare beneficiaries will pay a monthly premium of $144.60. So for those of you that have been around SHIP and SMP for a few years, you have definitely seen this go up. I think when I started it was probably $120, I think. So it has increased over the years. And with the Part B premium, it is not based on work history. That premium is based on someone's income. So if you are following along in your 2019 volunteer manual, I'm moving to page 46. With the Part B premium, it is based on income, and there is a 2-year look-back period. So for anyone that is going to be paying a Part B premium in 2020, Social Security is going to look at what their income was in 2018 to set their Part B premium. So you can see the income limit here for the $144.60. With the income limit, as the individual or couple's income increases, there is an income-related monthly adjustment, we call it IRMA, applied to their Part B monthly premium. And I know that you guys have, when you talk with folks, that those folks that fall into these categories sometimes feel penalized for making more money. And then sometimes they say, yes, I understand, I'm glad I can contribute. So you never know what you're going to get when you share with someone that they're more than likely going to have to pay this IRMA on their Part B. So you can see based on the income limits, of course, the higher the income, the higher the premium. So we really have people that are paying $144.60 to some of those that are paying $491.60 per month for their Part B premium. You may want to note that many times people, particularly that are new to Medicare, had a higher income 2 years prior, and with retirement or ending their work, that income is going to drop drastically. So please encourage them to contact Social Security, and there are opportunities for Social Security to work with them and adjust that premium because of their income changing significantly. So before I leave Medicare Part A and B, are there any questions? All right. So we're going to move on to D for prescription drug coverage. And just like the IRMA for Part B, we also have IRMA for Part D. So we can almost guarantee if someone has IRMA for their Part B monthly premium, they're going to have the IRMA for their drug coverage as well. So the income limits are the same. And for whatever reason, this chart has a tier on it. I'm sure that the Part B is tiered as well. But you will see that when someone is below $187,000 as a single person or $174,000 with married, that they will not have an additional Part D or prescription drug plan premium add-on. So whatever that premium amount is what they're going to pay. So if someone is enrolled in AARP Medicare RX Walgreens with a monthly premium of $34, that is what they're going to pay. Now, if someone is in a higher income and they are enrolled in that prescription drug plan at $34 a month, then whatever their income limit is, let's say they're in a Tier 1, it will be $34 plus the $12.20. So when you are working with someone on the plan finder and they're new to Medicare, you're not going to see that if that additional pricing. I don't believe that you see it at all. Has anyone seen the additional IRMA on anyone that they've run a plan comparison on? Okay, just because I hadn't, I didn't know if that would be. But that will be interesting to watch in case they ever add that as they continue to upgrade that plan finder. All right, so we're going to move to Medicare savings. And I just realized I have left off one of the screens, but we'll fix that in a minute. All right, so let's talk about the drug plan premiums. And if you were following along in your 2019 volunteer manual, the Part D IRMA is on page 90. And we are going to move to the Part D premium subsidy. And I want to talk about this chart a little bit. In the volunteer manual on page 264, where I'm going to go. And I want to make sure that we all, 244. We're all on the same page with the understanding of this chart. So federal poverty level is created by the federal government, and that usually comes out sometime during March. So the income is going to be changing for 2020. So the cost tip sheet that you have, if you go to the last page on the bottom right, you will see someone's initials and the date. So right now, the cost tip sheet that you have has SJ, which is me, and it has 01/15/2020. Always make sure that you have the most recent version, because once the federal poverty level rates come out, if there's any adjustment on this tip sheet, we'll update that and we'll mark the date that it's updated. So we'll really work with your regional SHIP SMP coordinators to make sure that the tip sheet gets pushed out as it's updated. So with the federal poverty level, you can see that we've got the percentages of level, and then to the right of that, we've got the percent of subsidy. So if someone's federal poverty level is hitting at 135%, then that's going to put them at receiving 100% subsidy, which means that the subsidy will cover up to $32.74 of a prescription drug plan premium. So when you are working with someone, you can look in your 2020 handbook, and if that monthly premium is in blue ink, then you know that that plan is participating with subsidy, and the premium will be adjusted accordingly. If it is in black ink, then that prescription drug plan is not participating, and the person, if they are qualified for the subsidy and enrolled in that prescription drug plan, most likely will not be receiving the benefit that they are eligible for because they have not selected. So I want to make sure that everyone is aware of that and works through that with your counseling. So as you can see, with 135% federal poverty level, I'm going to move on and kind of go back and forth. You can see that someone is going to qualify for a Medicare savings plan, which is the QI1 back to QMB. So that income is going to be between, for a single person, $1,061 up to $1,426. So let's go back. So as their income increases between that Medicare savings program, the federal poverty level will go up. And that's why you see some people pay a little bit more than other people. So if their income is more than 35% of the federal poverty level, but not more than 140, they get 75% subsidy. So they will get assistance for paying a prescription drug plan premium up to $24.55. So if they are enrolling in a plan that is more than $24.55, they will have to pay the difference. And so sometimes you may be talking with a Medicare beneficiary and they say, well, I'm paying a premium. And you say, well, you shouldn't. Before you say you shouldn't, make sure that you know where they are falling with that prescription drug plan and the percent and the dollar amount for their premium. So once they are over that 150% federal poverty level, that means that their income is over $1,581 as a single person and over $2,134 as a married couple. So that's how you toggle back and forth between these two charts. I haven't quite finished the chart, but I think Helen has a question. Oh, okay.
Yeah, Shannon, I'll go ahead. Yeah.
Okay.
Her question is, how can we tell which PDP plans participate on Plan Finder?
So I do not know that there is any type of graphic that shows us on the Plan Finder. And if the person is already receiving any type of subsidy, whether it be LIS or MSP, then that should automatically be populated, and you'll see their premium reduction in the comparison. If the person has not qualified yet or is in the process of applying, then we'll have to manually select what level of subsidy we think they're going to get. And I think that's at the beginning of the Plan Finder when you're entering information. You won't be able to log a person in who doesn't have Medicare benefits yet. So that's the only way that I know. Does anybody have any other ways that they're using that I'm not aware of? All right. Well, great question. Thanks so much, Helen. So we've talked about the federal poverty level, and we've talked about the percent of subsidy, and we've talked about how that subsidy is applied to the monthly premium of the prescription drug plan. So let's look at the language that we may see in Plan Finder. So when you are doing a drug plan comparison for someone that has an account, then once you get in to the Plan Finder, if you click on their name, the box should drop down and it should tell you their current plan and their current subsidy level. If it has no current subsidy level, then they may be in the application process or there could be a problem, and that's when we have to dig a little bit deeper. But if CMS continues to use this language, we'll look at it this way. If they change the language, we'll change the cost tip tool. But for now, you have heard the term full benefit dual. And what that means is that someone is receiving both Medicaid and Medicare. And depending on their federal poverty level, they can either pay zero copay, or if they are a partial benefit dual, then they would have a copay of $1.30 up to $3.90. If they are full extra help or partial extra help, but is also dependent on the asset level, their copays could be $3.60 or $8.95. So then you can see as you go down that column, if they are a true partial extra help, then you will see that they will have an $89 annual deductible. If they are at 140% to 145% federal poverty level, then their deductible can be $85. You know what? I think they all should be $89. That is probably a typo. I am sorry about that. I will get that corrected and sent to you guys. They should all be $89. And then the 15%, there is a possibility that they would pay 15% of the cost of the drug. Now, I don't know if that is going to change with the revised true out-of-pocket cost troop, but once I know for sure, then we can revisit this. I'm going to check my notes real quick and make sure that I haven't missed anything that I wanted to share with you all. The other thing that I wanted to share with you all about the beneficiaries that are receiving subsidy is that they should be exempt from the coverage gap. So when you're in the plan finder, that the box that shows you their initial and everything, that should be pretty flat for folks receiving subsidy. So if it isn't flat, then you may want to take a few more minutes and see what's going on with that individual. I want us to look at these levels a little bit more. And if you're following along with me in your 2019 volunteer manual on page 264, I think everybody knows that Medicare Savings Program includes QMB, which is the Qualified Medicare Beneficiary. It also includes SLMB, which is your Specified Low Income Medicare Beneficiary. And it includes QI1, which is your Qualifying Individual. It's not on this chart because we don't get that many calls about, but it also includes the Qualified Disabled and Working Individual. But those are so rare, and those folks typically don't call SHIP and SMP for assistance on that piece. I did not include it in this chart, but if it gets to a situation where we need to, then we can add it. So with QMB, SLMB, and QI1, you can see that Medicaid has given them, and when I say Medicaid, TennCare has given them levels. So level 2 is QMB, level 1 is SLMB. So when you go back and you're seeing under the Plan Finder language, then you'll see level 2 written out, and then level 1, as much as I could include that. So I just want to make sure you're understanding the chart. So there is a question that's come through, and it says, is there a way to apply for the partial extra help online, or do we always have to have the folks call Social Security? So there is not a partial extra help application. You can go online to Social Security's website and complete the extra help application, and then Social Security will determine at what level they are on. So good question. Oops, went back too far. So in this chart, we've included the income limits for each level of Medicare Savings Program and for extra help. So keep in mind that extra help is through Social Security. So if someone has an income of $1,500 or $2,100, depending on the married or single, then you would definitely want to go ahead and help them apply for extra help using the online Social Security application. When you help someone with an application, be sure to record that so that it's not only do you get credit for SHIP, but you get credit for our MIPA grant as well, and your regional coordinators can share with you the differences on those. So the LIS application stops the application if the income is above a level for full extra help. I don't know what to say about that. So if you can't complete the application, then absolutely call Social Security and see what they can do. They may have to go down. So yeah, sorry about that. The resources, you always can look and ask the person what types of resources, and keep in mind these are CDs, any type of savings, rental property income, alimony, those types of things. And you can see as for Medicare savings programs, whether it's QMB or QI1, the single and married amounts are the same. And for extra help, you can have a little bit higher savings than those folks with Medicare savings program. I also have a little note on here, and one of the things we do get questions about SSI, which is Social Security income. And if someone is single, that SSI check for them is going to be $771 right now. If they're married, it's $1,157. With SSI, they are automatically receiving Medicaid benefits, and so they do not need to apply for extra help or a Medicare savings program. They're already getting that benefit, even though it's not actually called that benefit. And that can be confusing as a counselor as well as to some of the Medicare beneficiaries. There is a level 3, and that is nursing home Medicaid. I have not included that information on this tip sheet, but if that is something that you would like to have at a later date, please let me know and we can figure out a way to get that on here. I do want to let you know that the incomes that are listed here should include the $20 general exclusion. It's just automatically taken off of their income, and then on their resources, the burial allowance of $1,500 is also automatically removed. So if someone is a little bit above what you are seeing on this chart, still go ahead and help them fill out that application or MSP or extra help, because we sure don't want to be the one to determine whether or not they'll be approved. That is not what we are needing to do. So Carol Samuels is telling me that SSI went up to 783. So we will get that corrected. Carol, do you know what it is for married? Carol, are you there? All right, so we'll get that. Oh, okay, so she's saying it's $587 each. So I'll do the math and get that corrected on the cost tip sheet and get that back out to you guys. All right, so I want to open it up for questions. We have about 15 more minutes if you'd like to ask questions. I can't say that I'll know all the answers, but maybe among the folks that are on here, we've got some folks that have counseled for a long time that may know. So I'm going to open that up. Anybody have a question? You can unmute yourself. So I want to see if I can get to the cost tip sheet, because I failed to, let's see, I left a box off in my PowerPoint. And can everybody see the cost tip sheet? Bonnie, can you see it?
Yes, sorry.
Okay,
I forgot to
great.
unmute myself.
So this Part D information here, I failed to put in the PowerPoint, so I'll get that updated. But I do want to talk about it real quickly because it's very important, and it is one of the trickiest parts, and I struggle with this as well. And so let's work through this. So with the new donut hole, everybody, I hope you know that now there is a 25%, whether or not it's generic or a brand name drug, and how they work through that true out of pocket is in this chart. Now, before I move through that, see this Tennessee benchmark of 32.74? So that benchmark is the prescription drug plan premium that is used to calculate the percent of subsidy. So if you look here, you see that we had $32.74 as the amount of help. So if someone is receiving full benefits, a full benefit dual, their prescription drug plan premium will be covered at 100%, so long as that plan is $32.74 or less. So that is considered the benchmark for prescription drug plan premium. So that's how that falls in line. So let's talk about the prescription drug plans. So for 2020, the deductible, the maximum deductible of any prescription drug plans is at $435. So an Advantage plan can charge that as well. I don't know of any plans that are charging that on the Advantage side, but the prescription drug plans can do that, and many are. during the initial coverage limit, that calculator for the prescription drug calculates that drug at the 100% cost of that drug, not the discount that the Medicare beneficiary is receiving. It is the full cost. When that calculator, during that initial coverage limit, that calculator is calculating up to $4,020. When they reach that limit, then they are in the out-of-pocket threshold. And the calculator, they're now in what we consider the donut hole. So while they are in this out-of-pocket threshold, they are paying 25% of their drug costs. Once their total covered drug spend out threshold reaches $9,719, they are out of the donut hole and now in catastrophic coverage. That means that they'll be paying 5% of their drug cost. So I'll give you all a few minutes to absorb that, but that is the TROOP, and what TROOP means is the true out-of-pocket cost for Medicare beneficiaries with their prescription drug piece. Now, one of the things you may not have known is during catastrophic coverage, the minimum cost sharing is $3.60 or $8.95. So that's good to note. Underneath that, we've included the low-income subsidy copayments. If someone is receiving MSP or extra help and they are in the nursing facility or another institutionalized healthcare facility, then their drug costs will be $130 to $390. Up to the 100% federal poverty level, then they would go to the $360 and $895. So when you go to this plan finder language, then you'll see where that coincides with this LIS copayment. And here's that partial piece that keeps popping up. Do note that coinsurances may vary in Advantage plans. So everything I've talked about today applies to original Medicare, and then the variances can show up, particularly in the copays, annual deductibles, and coinsurances. Those can vary with a Medicare Advantage plan. So are there any questions now that we've talked a little bit about this Part D true out-of-pocket cost? All right, well, you guys are really quiet. So I hope that you've got information, something new, if it's a tidbit of new information, or I hope I haven't just completely overwhelmed you that you're thinking, what in the world have I got myself into? Please be sure and type your name into the chat box. Whoops. Let's see. There we go. So do we have any questions? All right, Lonnie, were you able to help me and write down all the names in the chat box?
Yes, but I can also print the chat box, so
Oh.
I will do that also. But I have
Awesome.
written down everyone's name. Except we've got 2 calling users, and I'm not sure who those 2 are, but I've written everybody's names in both, so.
Hey, Lonnie, this is Rose Benson.
Rose?
Hi,
Okay.
Rose. Thank you.
Hi.
Any other call-ins that have not put their name? We've got two. So we got Rose. There's one more person that called in. Who is it?
Hello?
Peggy, you got your hand up. Do you have a question? Peggy Ransom, do you have a question?
Well, Shannon, I'm guessing no one has any questions.
Okay.
I'm guessing. I don't know.
All right. Well, everybody, thank you so much for joining us, and we will have our February call on Thursday, February the 20th, and we will talk with you then. Have a great rest of the day, and thanks so much.
Bye-bye.
Okay, I've got the chat printed. You can probably stop recording now.
I will do that.